In Washington state, the nursing home considered the epicenter of the virus in the U.S. is now reporting more than 24 deaths. The situation is so critical, the governor has announced all nursing homes in the state will be restricting access. Only one visitor will be allowed in each day. Visitors must follow COVID-19 screening, along with signing in during every visit, and employees and volunteers will also be screened at the start of their shift. But is it enough to help some of the most vulnerable? Joining me now, Dr. Lona Modi, the Director of Geriatric and Palliative Care Medicine at the University of Michigan. Doctor, thanks for being on.
Sure.
I know you specialize in the spread of infections within nursing homes. So what steps should be taken at these facilities the moment someone is diagnosed with COVID-19 or suspected of having it?
I think the first step that nursing homes have to take is to be in touch with their local state public health officials. They are the ones who will be helping nursing homes to direct a response to the initial cases, as well as informing the family staff and taking the first steps to diagnose that case and others appropriately.
Now, for those with loved ones in nursing homes, how can they ensure the facility is prepared for a possible outbreak?
No, that's an excellent question. I think the loved ones should be making sure they ask the right questions to the nursing homes. Are your staff trained? Are your staff washing their hands and using appropriate measures to prevent transmission of infections in the setting? What else are they doing to reduce the adverse consequences to the older adults within the nursing home setting? How vigilant are they in communicating the latest news and the latest updates with the state, with the local hospitals, with the patients and the families?
And I know you talk about getting answers and communication. We've spoken to several families of people who are there at the facility in Kirkland, Washington, where this all started. And one of their biggest complaints is lack of information. Some of them don't even know if their relatives are okay or not. How does a facility control that kind of communication and make sure people are getting the answers they need in a crisis like this?
Yeah, I mean, I think one of the challenges that nursing homes often face is that they may not have the most up-to-date information or contact information for their family and loved ones. So I think staying ahead of communication is extremely important, having a streamlined process as to, from the leadership down as to who is in charge of the communication. Can you use a variety of ways to pass your message on is extremely important.
And doctor, any other words of advice for either residents in this kind of facility, the facility themselves, or family members who have people there?
I must say that this is a really stressful time for the entire nursing home industry, physicians, patients, families, and everyone. I want people to know that there are many entities, professional societies, CDC, who are equally concerned about this population, and they're coming up with guidelines as we speak to help nursing homes combat this virus. All
right, we certainly hope so. Dr. Lona Modi, we appreciate your time. Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.